Hello, my name is Spencer Whitmire, and I'll be talking about Mr. Johnson's complicated hyper blood pressure and everything that fell in between A to C. So I'll begin. Mr. Johnson, I want to start by explaining what high blood pressure actually is and how it develops in the body in three categories: primary, secondary, complicated hypertension. Primary hypertension is the most common form of high blood pressure. It develops gradually over time and does not come from one single identifiable cause. Instead, it is the result of multiple interacting factors such as genetics, long-term dietary habits, lack of physical activity, stress, alcohol use, and changes in how the body regulates vessel tone and fluid balance. Over time, the blood vessels become less flexible and more narrowed, which increases resistance to blood flow. As a result, the heart must work harder to push blood through the body, which slowly raises blood pressure over years. Research shows that this process involves long-term changes in vascular structure and regulation, including dysfunction of the endothelium and altered nervous and kidney control of blood pressure. Secondary hypertension is different because it has a specific underlying medical cause. This means that elevated blood pressure is not happening on its own, but rather because of another condition is driving it. Common causes include kidney disease, hormonal disorders such as excess cortisol, and certain medications. In these cases, the body may retain too much fluid or experience abnormal tightening of the blood vessels. For example, kidney dysfunction can activate hormonal systems like the renin-angiotensin-aldosterone system, which increases both fluid retention and vascular constriction, leading to higher blood pressure levels. If the underlying cause is identified and treated, blood pressure can sometimes improve or even normalize. Complicated hypertension refers to a long-standing, uncontrolled high blood pressure and has begun causing damage to organs throughout the body. When blood pressure remains elevated for many years, it places constant strain on the heart, brain, and kidneys, and even the eyes. The heart in particular must continuously pump against increased resistance, which causes the heart muscle to thicken and stiffen over time. The process can eventually lead to decreased heart efficiency and heart failure if left untreated. These structural and functional changes represent the transition from simple elevated blood pressure to true organ damage and cardiovascular disease. Mr. Jones, when I look at your health history as a whole, there are several clinical significant findings that are directly contributing to your high blood pressure and your current symptoms. The first major factor is your long-standing history of uncontrolled hypertension, combined with a strong family history of cardiovascular disease and diabetes. Both of your parents had hypertension, and your mother also had type 2 diabetes. This genetic background places you at a significant higher risk of developing more severe and difficult to control blood pressure over time. Genetics alone do not determine the outcome, but they do increase your baseline vulnerability. The second important factor is your current lifestyle pattern. You report drinking several beers every evening, not monitoring your sodium, fat, or carbohydrate intake, and not engaging in consistent exercise outside of the job requirements. These behaviors all contribute to an elevated blood pressure by increasing fluid retention, vascular resistance, and long-term strain on the cardiovascular system. Alcohol use, particularly, is known to raise blood pressure and make it more difficult to control with lifestyle changes or medication. Another significant finding is your 20-pound weight gain over the past year. Increased body weight is strongly associated with worsening hypertension because it increases the workload on the heart, contributes to insulin resistance, inflammation, and increased vascular resistance. This creates a cycle where blood pressure continues to rise and becomes harder to manage. Finally, your report of shortness of breath with activity, especially when climbing stairs, is clinically important. This symptom suggests that your cardiovascular system may already be under strain. In the context of uncontrolled hypertension, this is the early warning sign of the heart beginning to struggle with the increased workload. This may indicate early structural changes in the heart or reduced cardiac efficiency, which are important to address early before more serious complications develop. One of the most important long-term complications of uncontrolled hypertension is the condition called left ventricular hypertrophy. This refers to the thickening of the muscle wall of the heart's main pumping chamber, the left ventricle. To understand this more simply, think of your heart as a pump that has to push blood through the network of pipes. When blood pressure stays high for a long period of time, those pipes become tighter and more resistant. In response, the heart has to work much harder to push blood out with each beat. Over time, just like any muscle, this is overworked. The heart muscle thickens in order to handle the extra workload. At first, this thickening seem like an adaptation, but it actually becomes harmful. As the heart muscle grows thicker, it becomes more stiff and less efficient. This means the heart has a harder time relaxing and filling with blood between each beat. Eventually, this can reduce how well the blood is pumped to the rest of the body and can lead to symptoms such as shortness of breath, fatigue, and reduced exercise tolerance. Research shows that this structural change significantly increases the risk of heart failure, arrhythmias, and other cardiovascular events in patients with long-standing hypertension. The good news is that this process can be slowed and sometimes partially reversed if blood pressure is controlled early and consistently. The most important self-care steps include taking blood pressure medications exactly as prescribed, reducing daily sodium intake, limiting alcohol use, increasing regular aerobic exercise such as walking, and working towards gradual weight loss. These changes reduce the strain on your heart and help prevent further thickening of the heart muscle. Monitoring your blood pressure at home is also important, so you can keep track and progress early to any changes. Overall, the goal is to reduce the workload on your heart so it does not have to keep adapting to high blood pressure, which helps prevent long-term damages and improves overall cardiovascular health. Thank you, and that was the whole thing.